Welcome to the deep dive. Today, we're really getting into the story your blood tells. It's quite fascinating.
It really is.
Our mission, like always, is to take sources, like hematology and oncology, a concise guide, and pull out the key stuff about blood conditions.
Yeah, make it clear, make it stick, demystify some of those complex terms.
Exactly. So, let's start with anemia.
Yeah.
What is it, fundamentally?
Well, at its core, anemia just means you don't have enough healthy red blood cells.
Okay.
And that often connects to feeling tired, maybe looking a bit pale, low energy.
Right, the classic symptoms.
Exactly. And we measure this with hemoglobin. Normal levels, generally speaking, are around 12 to 16 for women, maybe 14 to 18 for men, give or take.
So low hemoglobin, you're anemic. But it's not just one thing, is it? How do doctors figure out the type of anemia?
Good question. That's where a couple of key lab values come in. Really important ones. MCV is one.
MCVs?
Yeah, mean corpuscular volume. It basically tells you the average size of your red blood cells.
Like small, medium, large?
Pretty much. We say microcytic for small, macrocytic for large, and normocytic for normal size.
Okay. And the other one?
That's MCHC, mean corpuscular hemoglobin concentration. It tells you about the hemoglobin concentration inside the cells. Are they pale, which we call hypochromic, or a normal color, normochromic?
So size and color intensity, basically.
You got it. And those two clues together, they point us towards the likely cause. For instance, microcytic, so small cells, often iron deficiency, maybe lead toxicity, or thalassemia.
And macrocytic, the large cells.
That often points towards folate or B12 deficiencies.
Okay, that makes sense. Let's talk about iron deficiency then, since you mentioned it's common.
Oh, absolutely. The most common type worldwide.
And the causes are usually bleeding or just not getting enough iron.
That's right. Chronic blood loss somewhere, or poor dietary intake. Symptoms are that fatigue we mentioned, pallor.
And you also see that strange thing, PCOS, right? Craving non-food items.
Yes. It's surprising, but a real sign. Craving ice, dirt, clay. It's often linked to severe deficiency.
Wild. So treatment?
Usually straightforward oral iron pills. Best absorbed on an empty stomach, maybe with some vitamin C like orange juice to help.
But constipation can be an issue.
Definitely a common side effect to manage.
Yeah.
And a key prevention point, especially for little ones. Limit cow's milk for babies under 12 months. Too much milk can actually block iron absorption.
Good tip for parents. Okay, so small pale cells point to iron. What about those large cells, macrocytic anemia? You mentioned B12 and folate.
Exactly. High MCV points us there. B12 deficiency is particularly interesting, especially something called pernicious anemia.
Pernicious anemia, what's that?
That's when your stomach doesn't make something called intrinsic factor. Think of it like a key needed to unlock B12 absorption.
Ah, so is that the key?
The B12 can't get in no matter how much you eat or supplement orally. So these people need lifelong B12 injections. Intramuscularly.
Wow, lifelong.
Yeah. And another thing, neurological symptoms, numbness, tingling, balance problems, they're much more prominent with B12 deficiency compared to folate deficiency. Both can cause a sore, smooth tongue, called glossitis, though.
Okay, so B12 needs that intrinsic factor, potentially lifelong shots, and watch out for nerve issues.
Got it. Let's shift gears a bit. Sickle cell anemia, that's genetic, right?
Yes, autosomal recessive. It means red blood cells can change shape, become rigid, sickle-shaped.
And that leads to those painful episodes.
The vaso-occlusive crises, exactly. The sickled cells block small blood vessels, causing intense pain and cutting off oxygen.
What triggers a crisis?
Things like getting sick, dehydration, even being at high altitudes, hypoxia, stress on the body.
So patient education must be huge.
Absolutely crucial. Getting all recommended vaccines is vital to prevent illnesses that could trigger a crisis. And avoiding high altitudes. If someone suspects a crisis, it's straight to the emergency department for fluids, oxygen if needed, and pain management.
Right. Okay. Now we've talked a lot about deficiency. What about the opposite problem? Too much iron.
Good point. Iron overload is also a serious issue. There's hereditary hemochromatosis.
Another genetic one. Yes. In this case, the body absorbs too much iron from the gut. Over time, that iron builds up in organs, liver, heart, pancreas, and causes damage.
How is that treated? It seems tricky.
Actually, the treatment is quite old school, but effective. Phlebotomy. Basically controlled bloodletting to remove the excess iron.
Interesting. And you also mentioned polycythemia vera.
Right. Slightly different, but related. That's a type of blood cancer, a myeloproliferative neoplasm, or the bone marrow just goes into overdrive, making too many blood cells, especially red cells.
Which increases clot risk, I imagine?
Significantly. And guess what the main treatment is?
Let me guess. Phlebotomy.
You got it. Phlebotomy, again, to reduce the sheer number of cells. We should also briefly mention secondary polycythemia. That's not cancer, but high red cells due to things like living at high altitude or chronic lung disease like COPD.
Okay, understanding the differences is key. Let's pivot slightly to public health. Hepatitis B screening. What are the key recommendations?
Yeah, important one. The CDC recommends screening for all adults at least once in their lifetime.
All adults, once.
Okay. Also, pregnant individuals during each pregnancy, and infants born to mothers who test positive for certain hepatitis B markers.
How do we interpret those markers, like HBsAg?
Right. HBsAg positive means an active infection could be acute or chronic. Total anti-HBC means a previous or current infection. It doesn't distinguish.
But what about immunity?
That's where anti-HBs comes in. If that's positive, it indicates immunity, either from having recovered from an infection or from vaccination. And if only anti-HBs is positive, that strongly suggests immunity purely from the vaccine.
That distinction is really important. Okay, last big topic, just some oncology basics. TNM staging.
Yeah, TNM is fundamental for solid tumors. T stands for tumor size and extent. N for node involvement has it spread to nearby lymph nodes. And M for metastasis has it spread to distant parts of the body.
TNM, got it. And key hematological cancers, leukemia, lymphoma, myeloma.
Exactly. Leukemia is cancer of the blood cells themselves, starting in the bone marrow. Lymphoma affects the lymphatic system, think lymph nodes, spleen. It has subtypes like Hodgkin and non-Hodgkin.
And myeloma.
Myeloma is a cancer of plasma cells, which are a type of white blood cell found in the bone marrow.
Okay. And what are some general red flag symptoms that might make doctors think about these conditions?
Well, things that warrant a closer look include persistent swollen lymph nodes, so lymphadenopathy, also unexplained fever, drenching night sweats, significant unexplained weight loss, and just profound fatigue. Those B symptoms are important.
Right, those constitutional symptoms. Wow, we've covered a lot of ground.
We really have.
From anemia types, MCV, MCHC, to iron issues both ways, sickle cell, Hep B screening, and basic cancer concepts. Hopefully you feel much better equipped now.
Absolutely. And maybe a final thought for you listening. Consider how understanding even these basics changes how you might interpret a routine blood test result, or the questions you might ask your doctor.
Yeah.
It's really about empowering yourself with knowledge, fostering that health literacy.
A perfect note to end on. Keep asking questions, keep exploring. Thanks for diving deep with us.